Hi, I'm Dr. Paul Lynch. Today I'm going to show you an intercostal nerve block, and I'm going to show you a couple different techniques. Now, today we're actually working on cadavers. I'm teaching at a lab, and we're taking a few minutes to go over some more advanced procedures. So we're going to start with an intercostal nerve block. This is a procedure that's been done for years by anesthesiologists in the hospital. We found it very effective after thoracic surgery, generally reducing the pain in the thoracic wall. Now, what we found in the pain management space is that it's actually very good for chest wall pain syndromes. And so today I'm going to show you this procedure, and I'm going to show you a couple of different techniques. I'm even going to show you how you could do a radio frequency procedure. So I'm going to go ahead and start with the basic classic teaching of an intercostal nerve block. So at this level, I can see the ribs. I'll use my marker to identify this is about the 9th rib. So what I'll do at that point is I'll numb the skin just a little bit, right overlying where my marker is there. I'll then take a needle and I'll direct it right towards the bottom of the rib. Now that's just a little bit too low, and I only go in a couple millimeters there. So I'll redirect that just a little bit above. Now I'm going directly at the inferior aspect. What I like to do is keep a little bone behind my needle to use it almost as a backstop, so I'll just touch the bone. But not so much that I can't walk under the bone when necessary. So at this point, I'm actually touching the bone on the very inferior aspect. What I can do now is just walk off the needle just right below the bone. Shot. I'll use the bevel to kind of guide it just a little bit below. Now I'm sliding just underneath the needle. You can see that on the image. And then just so that the camera can see a little bit, will you oblique a little bit towards you? I'm just going to oblique the angle so you can just see that the needle is just a little bit below the rib here. And you can see that there. Now it looks really deep there, but we just barely walked under that. I'm going to go ahead and show this to you at a different level now. Picture. 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 So I'm right on the inferior aspect there. I'll numb the skin just a little bit. Now, once again, this is a cadaver, so we don't really need to numb, but we're just showing you the whole technique on how to do it. Now, I'm just barely put my needle in, and you can see it's a little low, so I'm just going to go up a little higher than that, because I'd like to aim right towards the inferior aspect of the bone. Now, right there, I'm contacting off, so I can feel resistance, so then I'll just kind of rotate my bevel, and I'll slide right under. And right there, then I'll just aim up just a touch. I just slid right under that bone as well. Now what I can do is, in a living patient, we'll put a little contrast in and we can see if it gets taken up intravascularly, because we don't want the medicine to go into the vessels, we want it to go along the nerve. Okay, and we'll go live here. You can see a little bit there, that's good, coming out under the nerve. So that's the way to do a classic approach to the intercostal nerve block. So now I'm going to show you a different technique for the intercostal nerve block. We already showed the classic technique where you go just on the inferior aspect of the bone, then walk the needle off under the bone in order to put the medicine on the intercostal nerve. A couple of years ago, a paper came out showing that doing an intercostal nerve block where you just go down and touch the middle of the bone and deposit your medication worked just as well as sliding your needle under the nerve, or under the bone. And so I've taught this technique to a lot of doctors because essentially what it does is it removes the risk of dropping a lung, especially when done with fluoroscopic guidance. We can see the bone, we'll go straight down and touch the middle of the bone, not the very bottom of the bone. And sometimes we go towards the bottom half, but we're certainly not walking under it, and thus it eliminates the risk of puncturing the lung. So I'm going to show you that technique right now. Shot. Shot. So you can see here now, my marker is directly over the rib. I'll then take my needle and place it directly through. And that's a little too low, so I'm just going to redirect towards the middle of the rib, just there. And now I'm touching right in the middle of the rib, and so when I put the medicine in, what happens is, because of gravity, the medication will fall right down underneath the rib and will still achieve the same goal. So that's two different techniques for how to do the intercostal nerve block. Now the last thing I'll say about this is in the first technique, when we were under the rib, you can also, if a patient does really well with a couple of blocks, you can do what's called a radiofrequency ablation procedure, where you heat that nerve and actually give the patient long-term relief. Thanks a lot for watching.